today's special edition of World Insight. A ray of hope over COVID-19 vaccines amid a global surge in deaths and infections. What's next in the battle against the coronavirus? Would it get worse before it gets better?
There will be many months where only a limited number of people have access to the vaccines, and so the difficult question will be who gets access first.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei. COVID-19 cases flare up across the world, unfortunately, without let up. So far, global cases have topped 59 million. No wonder consensus has been reached at the just concluded BRICS Summit, Asia-Pacific Economic Cooperation, and G20 meetings. Solid support for the WHO, improvement of COVID-19 diagnosis and treatment, as well as step-up vaccine research and manufacturing. They did agree to ensure equitable access to vaccines by making them a global public good. So today, we bring you a special edition on the global efforts to stamp out COVID-19. Let's turn to our panelists. For more on global cooperation on containing COVID-19, joining us in Seoul, Dr. Alice Kim Kyung-tan, internist at Ms. Medi Women's Hospital. And in Boston, Professor David Jones, a professor and doctor from Harvard University. And in New Haven, Xi Chen, associate professor of health policy and economics from the Yale School of Public Health. Thank you so much for joining us. A lot of stories going on these days regarding the geopolitics, political elections, and vaccines. What do you consider as the best news so far? Ms. Tan.
I am so thrilled to hear the results of the interim results of vaccine trials, the news from Moderna, Pfizer, AstraZeneca in the last week or so. The results have been very encouraging, and so I think we can finally say that there is now light at the end of the tunnel. We do realize that we have several months to go before we get the kind of herd immunity that we need through these vaccines, but certainly the news that we've heard is very encouraging.
On the other hand, Dr. Chen, I noticed that the number of tests for the interim results on various vaccines are kind of limited, to tell the truth. Would that be able to tell the real story, or do we still have to wait quite some time before the reliable results come out?
Yeah, those are the interim results from phase 3 trial. And so far, with the limited sample, I think those 3 vaccines are able to test on a diversified portfolio of population groups, but it is still vaccine efficiency testing, so which means that it works in a certain constraint condition. But we need to go beyond vaccine efficacy and testing the vaccine effectiveness to show how well a vaccine works when they are being used in a bigger population. So this may be a challenge in the later stage of the vaccine development.
Professor Jones, now you face a situation in a way that on the one hand, everybody is looking forward to the vaccine ASAP. On the other hand, there has to be a very careful process to go before the overall massive vaccination happening around the world to various kinds of groups. So I think policymakers and also scientists, medical researchers like you certainly have to walk a very fine line.
So one of the things we will have to decide is as we slowly increase production of these vaccines, there will be many months where only a limited number of people have access to the vaccines. And so the difficult question will be who gets access first. Fortunately, policymakers have been thinking about this for many, many months now, and so there are systems in place. And there are some international collaborative efforts, like the BRICS program, that will try to allocate the vaccines in a fair way throughout the world. Not all countries are participating. The United States has not entered this program. So I think there will be a time when countries get vaccines based on their ability to purchase it on the market. But I hope with so many vaccines looking like they're going to have good results, that we will very quickly have enough production to get reasonable amount of the vaccine to countries throughout the world.
Yeah.
It will take a lot of work to do that, but I'm hopeful that it will happen.
Well, are you talking about emergency use, urgent use, or are you talking about massive vaccinations? I think that's an interesting question, isn't it, with the limited numbers of cases for the test so far?
I think at least in the United States, people will use the vaccine as quickly as they can produce it. They're expecting to have enough vaccine for 20 million people by January 1st, and I'm sure they're going to use that supply in those 20 million people by January 1st. So yes, it'll just be an emergency use, but it's going to be an emergency use on a huge scale.
Yeah.
And I hope that what they'll do is they'll study these people carefully so that we can get better and better data on both the safety and the effectiveness, because I think these vaccines will be widely deployed before they're fully studied.
Dr. Tan, same question about South Korea. You know, for Northeast Asia, particularly China and South Korea, things are relatively calm compared to the rest of the world, thanks to the very early and also effective actions. Of course, this is an evolving situation. Nobody can be sure about what's next, but for now. So how do you see the South Korean policymakers' possible choices when it comes to vaccines and the scales of vaccines that will be used, given the fact that these vaccines, even though effective, but it is still based on limited cases and limited tests?
Right. So there are two main things that we're considering. One is the COVID-19, we have to think long term. So we know that this is going to be around not just for several months into the future, but quite possibly several years. And so in that regard, we are pushing forward with domestic manufacturing development of vaccines. We have 3 vaccines in the pipeline. They're still in early stages of development. They just entered phase 1 trials, but we do realize that, you know, we will be having to deal with COVID-19 not just in 2020, but 2021, 2022, for several years into the future. So that's one part of it. The other part, more acutely, is we're taking a little bit of a wait and see attitude because the prevalence here, the incidence is lower. We've decided first to secure enough vaccine to vaccinate 60% of our population by mid-2021. But we want to wait and see what happens with the first batches, maybe the first 1 million doses that are administered around the world before we launch the products here in our country. Of course, safety is the first concern. Because the disease is fairly well controlled, we don't want to introduce a vaccine that might have safety concerns.
Right.
Another consideration is that the vaccines that were in trials in the West, in terms of testing in Asian populations, for example, Moderna, they only had 4%, I think, of their trial participants as people of Asian descent. And so our regulatory organizations need to consider whether that subset, the data from that subset can translate into safety and efficacy data for our country.
Fascinating questions. And on the other hand, we see the very different circumstances in which different vaccines will be stored or transported, and how they are effective in different populations. So this also poses an interesting question to policymakers about what to choose, how to choose it, and at what time to choose what. So these are, you know, in the ordinary times, we would not even dig into at all. But right now, every detail become extremely important in the safety of human beings. So, Professor Jones, when you are saying that the U.S. needs to have urgent use of these vaccines, many of these questions will pop up in a very fast speed. Do you see policymakers are having a good rationale about this?
One of the things that has been difficult in the United States is a lot of the response to the pandemic has been left in the hands of each of the 50 states.
Yeah.
And so every state has its own policy. So what's happening right now is that the 50 different public health departments in each of the states has been asked to create its own plan for how it's going to obtain the vaccine and allocate the vaccine. And that's likely to be inefficient and confusing. But you know, the states are doing it. So the states right now understand that the first vaccine that will likely become available is the Pfizer vaccine, and so hospitals and cities are trying to buy the special freezers that they need to store it. My brother runs a hospital in New Hampshire, and they tried to purchase one of these refrigerators, and they're all back ordered. And so it'll be very complicated to try to get the infrastructure in place that's required to use this. The Moderna vaccine is slightly simpler to use, and the AstraZeneca vaccine is much simpler to use. And there are many other vaccines that will likely come onto the market in the next 1 month, 3 months, or 6 months. So it's going to be a very rapidly changing situation, and the governments and the hospitals are going to have to be flexible as they respond to the changing supply of vaccines and the changing rules that are required for using these vaccines safely.
I understand that your country is going through some kinds of political transition. I can't even say this word without using a quote mark, because there are debates about the election results. I know you're a scientist. You don't want to look into politics, and that's not your job. But now, as a medical scientist, you probably have to look into the politics, because you have to know what's going to be the policy and who is going to make the policies. So, Professor Jones, tell me more about how do you see this transition? This is political transition. This is exactly the time that's going to make the decision about the vaccines and the first batch of vaccinations in your country. How do you see these two things going parallel with one another?
So many of the crucial decisions, you know, the initial approval for both the Pfizer and the Moderna vaccines will presumably happen with the current administration. They're expected to happen within the next month. And so those systems are in place. The officials at the Food and Drug Administration have tried very hard to demonstrate that they are operating without political interference. And so I think many people will trust the decisions that they make. Once the vaccines are available, then a lot of the distribution will be managed by the companies interacting with each of the 50 states. And those mechanisms won't be disrupted by the change in the presidential administration. And I think people assume that when the next administration starts in January, it will continue, at the very least will continue and will very likely accelerate the kind of federal action that we've had so far. So I think people are hoping that the United States is on an upward trajectory, both with pandemic policy and also with more and more vaccines becoming available. So people are optimistic, but they realize it's going to take several months before we achieve the results that we're all hoping for.
Just to follow up on that, how to work on the issue about whether people want to be vaccinated or not. I know there have been some kinds of discussion, debate, if not fight, within the country. And there were also talks about whether science is relevant or not earlier. So how do you see when you have really the vaccine available now? It's not just empty talk anymore. It's you can have it or you don't have it. So how do you see that debate will likely to shape the practices?
It'll certainly be complicated, and I think public health officials are actively trying to develop strategies on how they can convince enough of the population to take these vaccines. Initially, when they were thinking the first vaccines might be only 50% effective, there was real concern, because if only half the population accepts it and it's only half effective, then you've only protected a quarter of the population, which probably isn't enough to generate herd immunity. But if these vaccines are as powerful as the companies suggest, and if you really do have a vaccine that's 95% effective, then if only half the people take it, you've still protected a huge share of the population. And so that may be adequate. They've also been tracking public thinking about the vaccines all the way through. And the number of people who are willing to accept a vaccine has been increasing during the past few months as the epidemic has gotten worse. And so the fact that the vaccines will likely become available at the moment when the epidemic itself is at its peak might help people become more willing to accept the vaccine. Of course, in the next month, they're only expecting about 20 million doses of the vaccine to be available. We need several hundred million doses of these vaccines. And so by the time that becomes available in March or in June, it's very hard to predict what public attitudes towards vaccination will be.
Now we are joined by Professor Liu Guoen, who's the director for the PKU China Center for Health Economic Research, and also he's a member of China's National COVID-19 Expert Team. Professor Liu, good to see you. Tell me more about, Professor Liu, your thoughts on China's biggest challenge at this moment, with the cases rising, even though in sporadic cities, but people are still extremely cautious and also extremely nervous about what to come during the winter time.
Well, can we, yes, we all noticed that there are some cases emerged in this beginning period of the winter, but that's well expected from beginning of the pandemic in spring. We know that would happen most likely, and so I think the cities are in a very good shape in terms of well control of the cases, because in China, as you all know, there is a very strong central government command, and local governments follow very closely to the government regulations in terms of tracing, isolation. I think all these measures will continue to make sure that the cases could be well controlled to the minimum level. So I'm not that so much worried about the risk of spreading the cases in the winter. Of course, I think we of course should be very careful. But I think we're in good shape in terms of the control of the virus.
Right. Another thing, Professor Liu, is recently, according to some of the latest research and trace of the cases, suggesting that quite a number of them have to do with frozen food imported into China, containers that has been shipping goods from outside China into the country. Some of those cases are directly linked to these. People are looking at these as the big suspects. So what do you make of the latest discussion about this?
For the food supply, as I said, I would not overstate the risk of consuming the food both from the local market and from imported market. I think government has been in real control and preparation for those.
Mr. Chen, you want to comment about that too? I know you've been following China's situation very closely.
China has largely have this pandemic under control, and it's now in a better position now to control for the transported, the imported cases. And I would maybe alert the health authorities to also look at the boundaries with some inland neighbors like Russia, like Central Asia. I think those are the areas maybe lack of attention compared to the air flight transportation and the airship products, because they are more asymptomatic cases imported from Central Asia, from Russia. So maybe they are different the strain of the virus, and also the customer control in those areas, in those inland laboring countries are not as much done as we have been doing for the air transportation.
Right. That comes to the question of national differences. Interestingly, Mr. Chen, for example, China, if you look at the number, it is rising. However, it's very limited, and therefore, the policymakers here probably, as we see as a journalist, have to walk a very fine line about how reliable the vaccines are vis-a-vis the relatively calm situation in the country. So that's a very interesting question, isn't it?
Yeah, indeed. So with China already gets the virus spreading largely under control, so China needs to collaborate with the rest of the world who are still in the stage of this COVID-19 spreading. So that means that the testing and mass production and the quality control has to be relying on international collaborations, but cannot be relied on the domestic market because China is already not having such an environment. So I think if we, given that the technology so far is sophisticated, but what's more worrisome would be the financing and the distribution. In other words, I think we need to make it affordable and make it available not only for China, for the United States, but for the rest of the world. And we have this hard lesson we should learn. One example is the TB. It still took around 1.4 million lives each year on average, mostly in developing world. Although the human society already have a vaccine being there, available for almost a century. So we don't want this mistake to be repeated for this COVID-19.
You're watching World Insight. We'll be back after this short break. Keep it here on CGTN. Back. You're still watching World Insight with me, Tian Wei. We are still talking about global efforts to clamp down COVID-19. And with me, a strong panel. Dr. Tan, before we come into the studio, many of you were discussing about what should be the updated policies different countries should have towards quarantine or origins of travelers and the latest test and the way of doing the test. So, Dr. Tan, tell me more about how South Korea, is thinking about this with the evolving situation of the pandemic.
Right. At the very beginning, of course, the Hubei province was the hotspot for the world, and so we had border controls banning incoming travelers from that region. As the pandemic evolved, there were other high-risk countries that were identified, and our solution was to require PCR negative COVID testing before boarding the plane. Yeah. And that was around the summertime. The situation has evolved again, and in my opinion, South Korea should re-examine its border control policies. We do have a very strict control measure right now for anyone coming in from outside of Korea. We are requiring a very strict, monitored 2-week quarantine period. PCR testing is required within 24 hours of arrival, and then also within 24 hours of the end of the quarantine. However, the PCR tests are not 100%, sensitive and specific. And right now, there are so many hotspots outside of our borders that I think we need to re-examine which countries we need to perhaps put on our watch list, and perhaps even consider even tighter border restrictions, such as, say, New Zealand, other countries that have had very successful COVID-19 campaigns, they completely closed their borders. And there have been a few days in the last couple of weeks where 25%, a quarter of our daily cases were imported cases. And this just adds not just risk of spread of perhaps genetic, mutated virus that's not actually been in our country yet, but it also adds to the burden, the burden on our healthcare system. And I think many healthcare workers around the world are feeling burnout, are feeling frustration, and anything that we can do to lighten the load on our healthcare system, and especially our healthcare workers, I think is a good direction to go into. And so I would encourage the government here in Korea to rethink our border policy. And going one step ahead, I think on the other hand, perhaps we can have a safe travel network among countries that do have good control. So between China, Korea, New Zealand, Vietnam, perhaps, we can have a safe travel network that allows more free travel between these countries that have very good COVID control and stricter border control on countries that are going through very, very difficult outbreaks right now.
What kind of coordination governments could have, not just regionally, but even beyond, because now we have sporadic successful cases around the world in terms of nations. So there were earlier several meetings last week. There's the BRICS summit in which the emerging economies leaders are talking about what to do next with COVID-19. Then there was the APEC economic summit with the leaders coming from APEC economies discussing what they can do within the region. Of course, it varies a lot from one economy to another. And then there's the G20, mainly the largest economies in the world. Their top leaders are trying to come up with something in terms of coordination. So Dr. Tan, do you see any direction among these policy outlines put out by these meetings that would be enticing to a medical worker and medical scientist like you?
Well, certainly collaboration on the bioscience front with a push towards better vaccine development. As I said, we're going to need vaccines for many years into the future, and so developing a vaccine that is temperature stable, that is cold chain free, that doesn't require the kind of cold chain that we have that's necessary for the candidates that are going through the finish line right now. That's going to be something that we need to look at, for years ahead, and certainly collaboration among countries. For example, a vaccine can be developed in a country, but there could be local manufacturing of the vaccine once it's licensed to another country. And so collaboration on that end will certainly help going forward. I think the most important thing is not just, everyone is waiting for the pandemic to end, but looking long term. What's going to be the picture in the years ahead? And I think that's where the efforts at collaboration, the seeds need to be planted now, the discussion needs to be started now in terms of where we're going to be in 2022, 2023.
Professor Jones, please also come in on this discussion. How can we push the policymakers and the politicians, state leaders, to be able to do coordination that is urgently needed?
Yeah, that will be a huge challenge, and I don't think there are good historical precedents that show cooperation of the level that we would want. Countries have been trying to cooperate with international public health for over 150 years, and sometimes they're great successes. The United States and the Soviet Union led the way with smallpox eradication, which was finally achieved in the 1970s, and so that's probably the best example of international cooperation. But there are many other examples where the cooperation isn't what we would want it to be. The United States did little to stop the spread of flu H1N1 in 2009. it took the world far too long to respond to the Ebola epidemic in West Africa in 2014. Now, this epidemic is different. This epidemic has affected the world and captured the world's attention in a way that nothing has probably since 1918. So maybe this will be different, and this will be the epidemic that triggers a new era of global cooperation. I think the change in the presidency in the United States will make it more likely that that will happen, at least more likely that the United States will collaborate seriously with other countries. And so I think it's possible, and I really hope that it does happen. I just wish there were better historical precedents than the one example we have of smallpox eradication.
Dr. Chen, your thoughts about how we can still push political leaders be able to do something that they are actually obliged to do?
Yeah, global collaboration is the key, and the global collaboration will not happen without the collaboration between China and the U.S. And it's promising that the incoming Biden-Harris administration put the COVID-19 top in the agenda. And I would say that the two countries could work together in enhancing the supply chain. For example, recently the data shows that the national stockpile for PPEs in America it cannot match the latest research. And this is an area the two countries can work together because there's excess demand from America, and now China is mostly get the virus spreading under control. So the production and the distribution of PPE has been maintained well. So the two countries could work together, and also the two countries can work together in financing and distributing the vaccines, like a few days ago, the AstraZeneca vaccine, which is cold chain free and which is lower cost per dose, and it can be a lifeline to the developing world. But given the scale of this crisis, we really need more varieties of vaccine in order to solve this global issue. So some vaccines are still on the trial rate in China and potentially at a lower cost and without high demanding shipment and distribution. So those financing and distribution of the Chinese vaccine, of the American vaccine, and the European vaccine will have this crisis better under control. And lastly, I would say is a longer-term collaboration. Biden-Harris administration is putting the climate change in one of its 4 top agendas. And we know that this crisis indirectly or directly have something to do with climate change because of the overlapping of the human world and animal world. So putting more risks of virus spreading through the intermediate host to the human world. So the two countries and the global community should work together to mitigate the worsening of the climate, and in order to eventually solve this issue instead of a one-term solution to this pandemic. We need a sustainable solution to future pandemics.
Professor Liu, your thought. China's practice might be a little bit different from some of the other economies. Go ahead.
I cannot agree more on the importance of collaboration across countries in dealing with the COVID-19. I just want to emphasize another point. That is about the safety issue of producing, storing, and transporting and distributing vaccines to many countries, including poor countries. I think that's very, very important issue. Some scientists warn that the challenges of the safeties in the process of distributing vaccines may not be less than developing the vaccine itself. So I think that's something we should keep in mind when we are talking about international collaborations. Okay, I would worry much more when we're talking about collaborations between developed countries and poor countries. How can we deal with that? I think in that regard, international agencies like the United Nations. WHO should play a better role so that we can minimize the risk of transporting and distributing the vaccines. That's one issue. Another issue is financing. How we're going to come up with the financing package to pay for vaccines, which cost the developers and manufacturers a lot of money. So how we're going to collaboratively come up with the way to pay for these products, even though these products would be eventually made as a public good to the citizens, but the investors, manufacturers need to be paid back for their investment. How we're gonna deal with that? I think that's something we need to talk about it.
I'm really afraid that the discussion, the real formal discussion about these topics, all of you have mentioned, and certainly needs a lot of deep insights into, have actually been delayed compared to the process of development already of the current events. So are we heading for something very dangerous as we speak, even though there's already, using your word, Dr. Tan, we see some light at the end of the tunnel?
I think the messaging needs to be, as you said, brought to the forefront. And this is something that we need to discuss, politicians need to discuss, community leaders need to discuss, and that is that, as I've been saying, COVID-19 will not be over in Korea until it is over for the entire world. And so, as we have this sort of instinct to go towards nationalism, with vaccine nationalism, I think we do need to get the message out there, shape public opinion, so that people will realize and support the idea that we do need a global approach to this global problem. And, just because we are able to, get herd immunity in Korea does not mean that we will be safe from the threat of COVID-19, that we do need to think outside of our borders and really support countries that perhaps are not as developed. And I think having people learn about it, about what the ultimate goal is, that it's not just to help others, but eventually it's to help ourselves.
Right.
The global community, we are all connected in this issue.
This is extremely important, the advocacy about, the way of thinking and the way forward. And finally, the other three gentlemen, briefly from every one of you, an insight before we wrap up about the current stage. Dr. Liu.
The outcomes of controlling COVID-19 should never be attributed to government controls, because there are some other factors to play equally important roles, including culture difference in people across countries.
Yeah.
And another factor is the natural forces, because there are different types of virus we're talking about facing different countries, and there are different type of genes of different populations. So those factors should be kept in mind. Therefore, as a result, when we're talking about collaboration cross borders, we should respect each other more, understand each other more instead of criticizing each other.
Yeah. Okay, Professor Jones, your final notes.
So I really do hope that the vaccines will be a transformative event in the history of this epidemic. It's going to be difficult to learn what we need to learn about them and to figure out which vaccines work best and how to use them best. And so if nothing else, there will need to be good information sharing from all the countries that are deploying vaccines so that we can collect information to figure out how best to use them. But I don't think we should rely on vaccines being the only solution. Many countries, China, South Korea, New Zealand, have demonstrated what can be done to control this epidemic even without a vaccine. And if those measures continue as needed, that will only help to bring this epidemic under control. So I don't think we should put complete faith in this vaccine and abandon the other techniques that we have learned. But I certainly hope and expect that life will gradually return to normal in the United States as it has in a few other countries. It might not happen until later in the spring or summer, but my hope, speaking from a university that is often full of international students, is that by next fall, Harvard will be open again for both United States students and for international students. And I look forward to welcoming my students in the classroom again.
I certainly understand what you're talking about and the realities you have to face right now. Thank you. And Dr. Chen.
Briefly, I hope through this crisis, the international community could learn from each other. There are many things we could learn from each other, and we can work together to learn to deal with the future threats to the human society. So do not waste this crisis. Try to reform and make tomorrow better.
We hope that will be the case. It's always an excellent experience talking to scientists and medical workers and researchers like you. Every time it's an eye-opening process for me, and I'm sure for our audience as well. Thank you so much for your contribution. Alice Kim-Kyung-Tan, David Jones, Xi Chen, last but not least, Liu Guo'en. Really appreciate it. Thank you. And that's all the time we have for today. If you'd like to see more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei on behalf of the team. Thanks for watching. Bye now.